Angela.
Good morning.
Happy post-Mother's Day.
Thank you so much.
How was it?
It was wonderful. I had a wonderful time the whole weekend. It was a Mother's Weekend.
Mother's Weekend,
really.
as it should be.
Yes. Oh my gosh, my kids did so good.
That's great.
Yeah.
Kim was asking why there's not a Kids Day, and I said that's because it's every other day of the year.
Every day is Kids Day.
That's right. So, today I thought we could talk about some of the things mother related.
Yes.
So there's, as I was driving in, I thought, we should have just made this entire month related to topics of moms and all the things that you poor women go through as part of that cycle, right?
Mm-hmm.
So
yes.
There's a lot of directions we can go, but today I think let's talk about so we see women in every different aspect, right? Sometimes we're talking to them about helping them try to get pregnant.
Mm-hmm. That's right.
Sometimes we're working with them through pregnancy. Sometimes we're, oftentimes it's after
Yes.
postpartum.
Yes. Mm-hmm.
Difficulty nursing.
That's right. Mm-hmm.
We've got then the stress, anxiety, depression of young kids and all the hormone changes and life changes and all those fun things.
Right.
Yeah. And then, right, empty nesting, transitioning out, all the changes hormonally that can also happen.
Oh my gosh, during that, that you merge menopause in with empty nesting.
Yep.
Woo, you got some biochemical chaos going on right there.
So there's a lot of ways we can go with this. I think today, what I see a lot more of is not so much the hormonal stuff. That's a lot more of what you're dealing with and seeing more on a more regular basis. What I see a lot more of is, a woman gets pregnant, so many changes happen during that pregnancy.
Yes.
Tons. So a lot of what I'm seeing is, at second, third trimester, a lot of changes physically are starting to take its toll, right? So You've got the increased weight in the front.
That's right.
You've got just the body changing to be able to do all of the things.
Right.
And so I see a lot of lower back issues. I see a lot of, we'll talk about, what is the baby's positioning as they start to get ready for delivery.
Yeah.
And also, naturally what has to happen is the shoulders have to start rounding. Mm-hmm. And I call that mom back because that's typically not going to change for quite some time because of the nursing and the constantly bending over and constantly holding and having a baby on your hip and everything just becomes so much in front of you and attached to you in some way that that just naturally brings the shoulders forward, which creates neck and upper back and lower back issues. So on my side of things, that's what I'm talking to a lot of women about, and it's completely normal. Mm-hmm. It's one of those things that, you can do as much as you can to try to prevent it or to manage it more than anything else. And that's what I'm talking to women about is, how do we manage this? Because you could be in the office every day, but you're pregnant and your shoulders are going to be rounding forward.
Motherhood has a posture.
Exactly, all day long, and so what does that look like? And I think part of it is just accepting that
right.
is
part of
body's changing a lot, and what can we do about that? So what do you see as we're looking at pregnancy and kind of towards the end of pregnancy? What are you seeing a lot of nutritionally or hormonally or getting ready to embark on this kind of new journey? That's right.
So on the nutrition side of the practice, this is where I see we have a lot less space. All of the space is becoming occupied. This is actually where you see a decrease in appetite, but upregulation in reflux. Those old wives' tales. But like you said, posture-wise, I believe it's relaxin that starts to set in to soften ligaments. Is that correct?
Yeah.
So as they're readying,
and so their pelvis is going to open up a little bit more to allow that room.
Their rib cage is my rib cage expanded. I gained size in rib cage each time I was pregnant, and I gained a size in my foot each time. Can we talk about that?
Wow.
Can we talk about my feet flattening and gaining a shoe size, right, during each pregnancy? And then I was blessed with a cup size each pregnancy too. So yeah. But that flattening out, right? Just what is the best way to take care of our bodies, skeletally speaking, as all of those changes are being made?
So, so starting at the bottom, because that's a great point. So, yes, first of all, if you have flat feet to start with, it's going to really take its toll, because when your feet flatten, it's going, as the feet flatten, it puts a lot more stress on the inside of your knees, your hips. It typically makes the hips roll forward a little bit. And so all of that becomes extremely more exacerbated as you put on weight. And as you're going to be carrying more weight in front of you.
Yes.
That just brings, that makes you want to lean back more. And now you're compressing and putting a lot more stress on those discs and joints. And then for every pound that you gain, you're adding 3 or 4 pounds of pressure to lower back, knees, like everything kind of below that. And so, tremendous difference. And so even if you have decent arches or high arches, almost always we see that change during pregnancy. Foot Levelers, the company we work with for our orthotics, they have a really interesting and amazing program where they take an initial scan of your foot, and then through pregnancy, they've got like different stages. And so, almost that follows the trimesters, where first trimester you're going to wear this orthotic, second trimester you're going to wear this one, because they know that's going to change throughout your pregnancy. And so you can take a tremendous amount of stress off of your knees and lower back and hip area by supporting the feet.
So I think that every woman is probably thinking the same thought or having the same question I'm about to ask. Does the condition of our posture during pregnancy affect back labor?
It can, but I think that there's so much more to back labor. I think that is way more baby positioning and honestly probably how you're laboring than it would be, posture wise leading up to that. Now, if you have something like a scoliosis, or you already have like a lot of lower back issues heading into pregnancy, then you want to be a lot more proactive leading up to pregnancy if you're planning it, and then once you are pregnant, through that pregnancy, being a lot more proactive, knowing that you're going to be having the delivery and it's going to be taking a tremendous toll on your lower back, just being pregnant. So I don't think like back labor is, I think that's a lot more of a positioning thing and some other factors than it is a posture.
Taking care of ourselves skeletally through the pregnancy, does that lend itself in any way to baby positioning?
I would say yes. At least that's been my experience.
Okay.
Right? So I'm not entirely sure what the literature, so I'm not a pediatric guy or pregnancy chiropractor. I have a lot of friends who are into that. But we do see, quite a few women who are pregnant and completely safe to, number one, it is 100% safe to get adjusted while you're pregnant.
Right.
There's no risk that, especially the type of adjusting that I do, that there's any risk to the baby or mother for getting adjusted. So let's just throw that out there.
That's good.
I think the bigger question is, how do I get adjusted when I'm pregnant? Right. And so the table moves and changes to accommodate you. So we can adjust and move the table as your stomach grows larger to still be able to get you a great adjustment and moving. So I would say number one, that's the biggest thing. Number two, what was your question?
I think I asked. I think my last question was, does getting adjusted through pregnancy help with baby positioning?
Oh, positioning. Yes. So yeah, anecdotally, I've seen that, right?
Yes.
And so oftentimes, we're dealing with, mothers who are also seeing midwives or maybe doing home births or, different kind of birth plan. And so based on baby positioning, oftentimes the midwives are telling them, go get adjusted, go get things balanced out, go... and oftentimes we do see an improvement and change in that. So, is it causation? Is it correlation? Right? Like the mother doesn't care as long as the baby's in the right position and there's no downside to getting adjusted to help with that. But yes, and then you look at Webster technique, which is designed to do some positioning and changing kind of the, helping to relax certain ligaments and see certain patterns with that. Yes, you can try to shift and help baby positioning through working with the pelvis in a couple different ways. So, yeah, for sure. I think the other thing that I talk with pregnant women about is you're probably going to need to get worked on more as you get closer to delivery. So typically it will start to follow the midwife's visits, right? Like beginning, you're not seeing them as often. As you get closer to your due date, you're seeing them every couple weeks, once a week. It's probably going to be the same sort of frequency coming in here and getting worked on because it's going to make, and again, I've seen this with a ton of women that we've seen in here. I believe it will make delivery easier if your pelvis is more aligned. It's we have a lot of women that will come in and they're close to their due date or they're past their due date and we've seen getting aligned and adjusted start to stimulate that process, right? So not like in the office, but later that night,
that would be exciting.
It's not
instantaneous.
Yeah, it's not just a button that we push and now you're in labor, but that would definitely be something.
That'd be great.
That would not be great. Yes, even if I could push that button, they're not pushing that button in the office. So again, yeah, baby positioning, delivery, just making it more comfortable for your mother. Hips, pelvis, upper back, just having more mobility and being a little bit more comfortable through all of that can make a huge difference.
Wow.
And then after delivery, a couple common questions that we get, or that I get most often is, okay, if I want to have my baby checked, like what's a safe period of time? What's what does that look like?
Mm-hmm.
And it is really up to the mother and parents in that situation. I would say it also really significantly depends on how did the delivery go, right? So my kids, I was working on them right away. There's no, again, it's not a safety issue because the type of adjusting that we're doing is not, it's a lot more pressure point based, and there's no crazy rotating, and the delivery is way more hard on a baby than any adjustment would be.
Exactly.
Especially if you're looking at C-section, forceps, suction. I mean, any of those will be tremendously more hard on a baby's head and neck and body than getting an adjustment well. So really it comes down to timing, like, when can you get in here? And then some of it comes down to, okay, let's just get used to my baby before I get it adjusted. And so I've seen babies a couple days old. I've seen babies, all the way up to, days, weeks, months, everything in between. So again, it's not a safety factor. And I would say I will say this, the more traumatic or the more difficult the delivery, much better to get them looked at and worked on sooner.
Yes.
I know my son, Chandra had been pushing for a long time. And so they finally did it in episiotomy. And so when he came out, he had a torticollis. It was really, neck to one side. And so the midwife was like, I'm assuming you can, work on that, take care of that. It's like, yeah, we can work on that. So right away we started working on it, and it did take a couple weeks before that worked out and resolved. But, I was thankful that I could, right? And I was also thankful that it didn't turn into any long-term chronic, difficulty breastfeeding, difficulty, with any other issues that could have come as a result of that. So yeah, right away we can start working on someone, or whenever the family feels comfortable getting them worked on. It's typically like right after delivery, or if we're seeing colic, difficulty latching, ear infections. Those are common times that I would also see or recommend getting a baby checked. And then I will say we see probably more kiddos as they start to get into the walking, right? Tons of falling. We'll see changes in coordination from getting adjusted. And so, really falling over too much or hitting their head all the time, or, crazy. Some things like that. Oftentimes it's working with a little bit in the hips and pelvis, a little bit in the neck. And, we've seen some pretty significant changes with kids transitioning into that walking period.
I remember Olivia learning to walk, and I remember so grateful having a friend of mine who is an amazing chiropractor watch her gait, because as she was learning to walk, her depth perception was off. So her leg would kick out and around and then land, and this thing that she would do. And after having her worked on, it completely changed the gait and her depth perception of being able to just walk the way that she was able to. So that was incredible. It's incredible to see, being able to see what you don't see. Like you recognize it, but you have no idea, you know, how that's affecting even just the way that they're learning to walk.
Yeah, and I think a lot of times with that transition from crawling to walking, parents are, you know, they hear the stories of, oh, my child was walking at such a young age, and you know, it's like almost this, here we go, my kid's a superstar because they're walking early. And I will say this, keep your kids crawling as long as possible. That pattern of cross crawl getting into the brain makes a huge difference developmentally and mentally later on.
Wow.
So the kids that just scoot, or the kids that really crawl for a short period of time, oftentimes, like, that's a neurological, not issue, but it's something that needs to click neurologically for them to have a lot more success later in walking and coordination and lots of other motor patterns that happen. And so certainly getting that crawling down the right way developmentally is a huge thing. So don't wish your child to walk sooner.
See, you don't hear that.
Yeah.
That's so, I love that.
Yeah. Plus, you know, you're chasing them around a lot more.
Right.
But, you know, I get it, right? It's a huge milestone, baby's first steps. But don't rush that. Don't rush that, for sure. And then I think, you know, as we're kind of wrapping things up, so because I feel like we could probably go on and on and on forever about this, is, okay, mom, how can you start to take care of yourself as you're having the life sucked out of you?
It's not like that for everyone, I promise. Like,
emotionally, physically,
right?
You know, like,
right.
Literally.
It doesn't have to be that way.
Yeah. And so, you know, one of the things that we have seen a huge, you know, tremendous difference with is pelvic floor incontinence.
Yes.
And using our Emsella chair postpartum. And we've seen it affect, you know, a couple different things, right? We've seen it affecting, you know, difficulty with controlling gas and bowel movements.
Yes.
We've seen it with the incontinence.
Yes.
We've seen it, you know, in my opinion, I think the biggest change is physically, yes. It's going to increase your pelvic floor, and it's going to make you, it's going to make a huge difference with incontinence. But it's the confidence, because, you know, from what I've heard women saying is, you know, you have a baby, your body has changed so much over the last 9 or 10 months, and now, you know, you're trying to take care of this baby, your body still doesn't feel like it used to, and it never will, right?
That's right.
And so, you know, that's a huge, like, mental transition. And so when you compound, like, you know, possibly having a partner, and then, you know, just not feeling great about yourself in a lot of different ways, increasing pelvic floor health can be a huge confidence booster for a lot of women as they're working through, you know, a lot of those changes.
Yes, it is. It really does rehabilitate all of those. We have so many pelvic floor muscles, right? And just being able to rehabilitate and lift that back up, and, you know, again, gain a little confidence, you know, at least then, you know, this isn't, you know, part of my new
Well, I think I think so many women just
think they have to live with it, actually.
100%. And that's what I was going to say. They think, well, this is just part of
right? This is just part of motherhood. This
Yep.
is just part of menopause. Like we'll go all the way through one day, but it shows up back again. Anytime a woman makes significant changes hormonally speaking, it is going to affect your pelvic floor. Always. So just keeping that in mind, because they don't tell you that up front, right?
Yeah.
They don't tell you experience it once again, once those hormones dip down, and fluctuate postpartum or perimenopausally speaking either, but it definitely does.
Yeah.
Right.
And it doesn't have to.
It doesn't have to. And you know what? I will also add this too, because anytime there's fluctuation and you're talking about confidence and not just like speaking, urinary leaking or anything like that, but like then we're talking about all those hormonal shifts lending themselves like to dryness and things like that too, which is again something I need you to know, like you don't have to live with that. Like once that pelvic floor is rehabilitated and you've got a good amount of blood flow and
the increase in blood flow is huge.
I mean, it changes everything.
Yeah. So incontinence, sexually, you're going to notice a difference, especially postpartum, right? Because all of you're younger, and so those tissues are able to bounce back more quickly.
Yes.
And so it is not like a death sentence for, peeing yourself every time you cough or sneeze for the rest of your life.
No.
Like, that's crazy to, believe that you have to deal with that. But that's what we've been told, right? It's just part of it, and, do some Kegels.
Oh my gosh. Don't even get me started on Kegels. If we even know, ladies, that we're doing it the right way, number one. Okay, who knows really if we're doing it the right way? If we're recruiting the muscles we need to recruit. I mean, we can try the whole elevator thing, the up and the down and all of that, but I can guarantee you that you have never actually had, as women, if we were really, really, really good at it, we can only get about a 30% contraction anyway, right? And once you use pelvic floor therapy or Emsella, you realize right then and there you never knew what a Kegel was. Like I can guarantee you that, right? not an effective Kegel at a 90 to 100% contraction, right? Yeah. Total game changer right there. Yes.
Let alone doing 11,000 of them in 28 minutes. Yeah. So yeah, that's going to change your pelvic floor. And just the time to take care of yourself, and there's a lot of other positive things. To take 28 minutes to yourself once or twice a week is also really helpful. So for all you mothers out there, if you're a new mother, congratulations. If you're more mother with older children,
if you are a mother who is full of wisdom, that is just, if you are a mother who has mothered your children and now you have grandchildren and you get to see that lineage that you have created, that mark you have made on life, yes, congratulations. So to all the mothers out there, that's right.
Happy post-Mother's Day. If you have any questions on anything we discussed today, please reach out. We're happy to help as much as we can, and if not, definitely point them in the right direction. We've got a lot of resources around all of these different stages of motherhood. So until next time, bye.